Heart failure is a condition that sounds alarming, and while it is serious, the name can be a little misleading. It does not mean your heart has suddenly stopped working. Dr. Marjan Assefi said instead, heart failure means your heart muscle isn't pumping blood as well as it should. Think of it like a plumbing pump that has lost some of its power. It still works, but it can't move water through the pipes with the same force, causing pressure to build up elsewhere in the system. This condition is incredibly common, affecting more than 64 million people across the globe. In the United States alone, nearly 7 million people live with heart failure, and this number is expected to grow as our population ages. It is a major reason people are hospitalized, particularly older adults. To understand heart failure better, doctors often talk about it in two main ways, based on how well the heart's main pumping chamber, the left ventricle, is working. The first type is called heart failure with reduced ejection fraction, or HFrEF. This is what most people think of as a weak heart. The heart muscle is enlarged and cannot squeeze forcefully enough to pump a normal amount of oxygen-rich blood out to the body. Imagine trying to squeeze a water balloon that has been stretched out. It just doesn't have the same spring back. This type of heart failure has been understood for a long time, and many of our most established treatments are designed specifically for it, helping the weakened muscle work better. The second and increasingly common type is called heart failure with preserved ejection fraction, or HFpEF. This one can be a bit more confusing. In HFpEF, the heart muscle can still squeeze well, but it has become stiff and thick. Because it's so stiff, the chamber can't relax properly between beats to fill up with enough blood. So, even though it's pumping out a normal percentage of the blood it contains, the total amount of blood being sent to the body is still too low. This type now accounts for more than half of all heart failure cases, and it is especially common in older women, as well as people with high blood pressure, diabetes, and obesity. The impact of heart failure varies significantly around the world, highlighting how our daily lives and environments shape our health. In Western countries like the United States, heart failure is often linked to aging and lifestyle factors like obesity and diabetes. However, in regions like sub-Saharan Africa, the condition often appears in much younger people, frequently caused by untreated high blood pressure. These geographical differences show us that heart failure is not just one disease. It is a complex syndrome with many causes. Understanding these different patterns is crucial for developing effective strategies to prevent and treat it on a global scale, ensuring everyone has a chance at a healthier life. One of the most important things you can do for your health is to pay attention to the signals your body is sending. The symptoms of heart failure often start slowly and can be mistaken for normal signs of aging, but they tend to get worse over time. The most common symptom is shortness of breath. You might first notice it only when you're exercising, like climbing stairs or carrying groceries. As the condition progresses, you might feel breathless even while you're resting or trying to lie flat in bed. This happens because the heart's inability to pump blood forward causes fluid to back up into the lungs, making it feel like you're drowning from the inside. Another key sign to watch for is swelling, also known as edema. This swelling most often occurs in your legs, ankles, and feet. You might notice that your shoes feel tighter, or see indentations in your skin after you press on it. This fluid buildup happens for the same reason it backs up in the lungs. The heart can't move blood efficiently, so fluid leaks out of the blood vessels and settles in the body's tissues, pulled down by gravity. Some people also experience rapid weight gain, several pounds in just a few days, which is almost always due to this excess fluid, not fat. It's a critical warning sign that your heart failure may be worsening. Fatigue is another major symptom that can be incredibly disruptive. People with heart failure often feel a profound sense of tiredness and weakness that doesn't go away with rest. This happens because the body's organs and muscles are not receiving enough oxygen-rich blood to function properly. Simple, everyday tasks that you used to do without a second thought, like taking a shower, making the bed, or walking to the mailbox, can suddenly feel exhausting. This persistent fatigue, combined with shortness of breath, can significantly impact your quality of life, making it difficult to stay active and engaged in the things you love. If you experience these symptoms, your doctor will start an investigation to see if heart failure is the cause. The process usually begins with a physical exam and a detailed discussion of your medical history. Your doctor will listen to your heart and lungs with a stethoscope and check for swelling. The most important diagnostic test is an echocardiogram, which is an ultrasound of your heart. It's a painless test that uses sound waves to create moving pictures of your heart. allowing your doctor to see how well its chambers and valves are working, and to measure your ejection fraction. Blood tests, like one that checks for a hormone called BNP, can also help confirm a diagnosis. For many years, treating heart failure, especially the HFrEF type, has relied on a core group of medications. This guideline-directed medical therapy includes drugs like ACE inhibitors, beta blockers, and others that help relax blood vessels, slow the heart rate, and reduce strain on the heart muscle. For HFrEF, a powerful combination known as quadruple therapy has become the gold standard. This includes a newer class of drug called an ARNI, which is more effective than older ACE inhibitors, a beta blocker, an MRA, which helps manage fluid, and an SGLT2 inhibitor. This powerful cocktail of 4 medicines, when taken together, has been proven to help people with HFrEF live longer, feel better, and stay out of the hospital. The biggest news in heart failure treatment over the past few years has been the incredible success of a class of drugs originally developed for diabetes, SGLT2 inhibitors. Dr. Assefi added landmark clinical trials like Emperor Preserved and Deliver showed that these medications, empagliflozin and dapagliflozin, also provide powerful benefits for people with the tricky-to-treat HFpEF. They have been shown to significantly reduce the risk of hospitalization and cardiovascular death for these patients. This was a monumental breakthrough, as doctors previously had very few effective options for the millions of people living with this stiff heart form of failure. These drugs are now a cornerstone of therapy for nearly everyone with heart failure, regardless of type. The innovation doesn't stop there. As we approach 2026, we're seeing even more exciting advances. The results of the SUMMIT trial in 2025 showed that new generation anti-obesity medications like tirzepatide can do more than just help people lose weight. For patients with the obesity-related form of HFpEF, this drug also reduced hospitalizations and improved heart health, likely by reducing overall inflammation and fluid volume. Furthermore, a medication called finerenone, tested in the FINEARTS HF trial, has shown great promise for HFpEF patients, even those already taking SGLT2 inhibitors. These breakthroughs are creating a new, personalized approach to treatment based on the specific cause of a person's heart failure. Beyond pills, technology is also playing a bigger role. For some patients, tiny implantable devices are making a huge difference. The CardioMEMS device is a perfect example. It's a tiny sensor, about the size of a paperclip, that is permanently placed in the pulmonary artery to monitor fluid pressure in the lungs. At home, the patient lies on a special pillow for a few seconds each day, and the device wirelessly sends pressure readings to their doctor. This allows the medical team to spot fluid buildup days before the patient even feels symptoms, so they can adjust medications and prevent a hospital stay. This proactive monitoring is transforming heart failure from a reactive crisis into a manageable chronic condition. Living with heart failure is a journey, not a destination, and it's a journey you don't have to take alone. Success depends on a strong partnership between you and your healthcare team. The most important thing you can do is stick to your treatment plan. This means taking your medications exactly as prescribed, every single day, even when you start to feel better. These medicines are not a temporary fix. They are working around the clock to protect your heart, reduce its workload, and prevent the condition from getting worse. Skipping doses or stopping a medication can allow symptoms to return quickly and can lead to a dangerous setback or a trip to the hospital. Unfortunately, studies from around the world show us that many people struggle with this. In some countries, the cost and availability of these life-saving drugs are major barriers. For instance, recent reports from parts of Africa show that fewer than 10% of patients are on the optimal 4-drug therapy for HFrEF, simply because the medicines are too expensive or not in stock. Even in wealthier nations, getting patients on the right combination of drugs can be a challenge. That's why it is so important to have open conversations with your doctor and pharmacist. If you are struggling with side effects or costs, let them know. There are often alternatives or assistance programs available. Your role extends beyond just taking pills. Lifestyle changes are just as critical. Monitoring your daily weight is one of the most powerful tools you have. A sudden gain of 2 to 3 pounds overnight or 5 pounds in a week is a red flag for fluid retention, and you should call your doctor's office right away. Following a low-sodium diet is also essential, as salt makes your body hold on to extra fluid, putting more strain on your heart. Reading food labels and avoiding processed foods can make a huge difference. Regular, gentle physical activity, as approved by your doctor, can also strengthen your body and improve your heart's efficiency. Ultimately, managing heart failure is about empowerment. The advances in medicine and technology have given us more tools than ever before to help you live a full and active life. But these tools work best when you are an active participant in your own care. Ask questions, track your symptoms, celebrate your progress. By working closely with your medical team and committing to your daily treatment plan and healthy habits, you can take control of your condition. Heart failure is a serious diagnosis, but with today's therapies and your dedication, it is a challenge that can be managed, allowing you to look forward to a brighter, healthier future.